It's like a stick of rock. You cut it open, it's got health inequalities going through it.
Justice delayed is justice denied. If healthcare is delayed, you're not really getting healthcare.
Do you think, oh God, it's like shoveling snow and it's still snowing?
Yeah. You have to be clearing it away all the time, because if you let it build up, the snowplows can't run and you get overwhelmed. It takes longer to dig yourself out.
Stories, labels, misconceptions. NHS remains a blessing. Created in 1948. We want it to remain great. A podcast where we share our stories, explore solutions in all their glories. They say it's broken, but it's not done. With your hosts Val, Barrett, and Dr. Jeremy Henderson.
Welcome to Stories, Labels and Misconceptions with Val Barrett.
And Dr. Jeremy Anderson.
And today we are still carrying on with our Health Inequality series, part 5. And we dive into the most recent diagnosis of our health system, the Lord Darzi Report of 2024.
Yes, it's been decades of reports about the NHS and the health service and what's gone wrong. Lord Darzi was the most recent author of these reports.
Yeah. As we discussed last week, we'll do a brief recap. Episode 1, what is health inequalities? 2, tackling the social determinants of health. 3, who gets left behind? 4, 4A and 4B, all the reports and still no change. And today it's all about Lord Darzi's report, which will nicely bring us up to date. So the previous reports, Black Report, the Eggerson Report of 98. Before the Eggerson Report of 98, there was a report done by some health professionals in 87 called the Service Divide.
Right.
Yes. And then the Eggerson Report came along in 98. Okay, let me go back. 1980, we had the Douglas Black Report, which was commissioned by the Labour government, released under Thatcher's government, and nothing was done with that.
More or less buried.
Buried dust. Health professionals realised nothing had been done. So in 87, 7 years after that, they did, I think it was called the Service Divide. They said that since the Black Report, health inequalities had widened. Nothing had been done. But we know that whenever a report's done, things are going to get worse before they get better. Over the decades, things systematically declined and got a lot worse. The Eggerson Report of 98 came the Monmouth Review 2010. He came back 10 years later in 2020. And then let's not forget Lord Darzi did a report under Gordon Brown in 2008 called High Quality Care for All, NHS Next Stage Review Final Report, which we know it's not really the final report. So that's Lord Darzi. So we come back under West Street. We're going to compare and look at the similarities between all these reports. But we know, without even having to read them in depth, we know health inequalities has worsened, poverty has worsened, access to services, whether it's GP, the waiting list.
Yes. Let's introduce the Darzi Report from 2024. This is the most recent one. Unlike some of the other reports, is that, to my eye, it doesn't seem to be addressing health inequalities specifically. It's not saying that there are these structural inequalities in the healthcare system. It's really just looking at the healthcare system in general and saying, here is a whole bunch of problems with the NHS right now. And
I'm going to disagree.
Where am I missing the...
No. because he hasn't said it
Yeah.
doesn't mean it isn't there.
I'm just saying he didn't say it.
He hasn't focused on it.
Yeah,
He
yeah,
just
yeah.
hasn't said the words, because
Yeah.
those words have been sung for decades.
Mhm.
But when you look into the report, it's like a stick of rock. You cut it open, it's got health inequalities going through it.
Yes, exactly. I didn't mean to suggest there's no such thing as health inequalities, just
No,
that wasn't
I know
described in the
that, yeah.
report. Yeah. Yeah.
Mhm.
Yes. Lord Darzi lays out all of these points. I'm reading the executive summary and all the numbered points. I agree with that there's certain things that the NHS isn't doing well. It's not entirely the fault of the NHS, but actually he's saying the nation's health is worse off. We're not as active, healthy. We're getting obese. We're getting older. All of these things are increasing people's ill health.
Yeah.
And that's putting a greater demand on the health service. So I think that's important to note.
Okay.
And then he talks about a whole bunch of where the NHS is at right now, where the health service is at, and the importance of waiting times.
Yes.
Justice delayed is justice denied.
No.
If healthcare is delayed, you're not really getting healthcare. So wait times is actually an important feature that we need to monitor, and it's not doing well. According to Lord Darzi, we're not meeting promises since 2015.
Okay. He states that between March 2010 and June 2024, 2.4 million to 7 million people were on the waiting list.
Mm.
And don't forget, before that, we had COVID. So we've got that backlog, that avalanche of snow to deal with, because it was bad before, but worse after. They shut up shop. Not all hospitals did, because my son still got his care.
And definitely COVID was an issue, but it wasn't the only issue. And there were problems before COVID. They were exacerbated by COVID. And people were struggling to see their GP. And point 7, he's saying there was 1 million people waiting for community services, including 50,000 who'd been waiting over a year. By April 2024, there were 1 million people waiting for mental health services. The demand for mental health services has surged.
Yeah.
Long waits are normal.
Do you think it's gotten so bad because COVID has exacerbated things, and we know more people, more young, are suffering from mental health, and there's not enough people being seen? Do you think, oh God, it's like shoveling snow and it's still snowing? We know realistically that there's no magic wand. No matter if we had £100 billion today, nothing's going to be solved tomorrow.
Yeah.
What I don't like I said last week, Lord Darzi's report covers 10 years. Fundamental change will take 10 years. Things can come quick in the first year, the first 3 years, but huge change is going to take 10 years. What I'm afraid of is when new government take over. And that's why I don't like 10-year plans unless taken out of politicians' hands. Because all it does is, it gets put to the scrap heap like previous reports. They delay it by thinking, okay, we'll show them we're doing something by doing another report, calling it another name, and nothing's done. We're just plastering over the cracks, and nothing is changing.
Yeah.
When they talk about reforming the NHS, it really needs to be taken out of their hands. For the sake of it to continue, it might not stay in the current form. If we're writing these reports and trying to get on with the work of delivering change within these reports, and for clinicians to get on board, for service providers to get on board, you want everybody to buy into this.
Yeah.
I want everybody to believe in this change.
Yes.
And they've all had a hand in it. So what can be demoralizing to any team, which I can imagine, is one day you're being told A, you've brought into it, you believe it, and then next minute, a new government has come in and said, no, we're not doing A anymore.
Mhm.
Do you see what I mean? That's
Yeah.
the part I don't like. I
Yeah.
don't know what you think as somebody that works in the NHS, because it can be confusing, not only for patients like myself. What about the people that work in the system? Have to
Yeah.
keep changing every 3 to 4 years. The message is changing. The message
Absolutely.
changes, but the problems are still there.
I like your snow shoveling metaphor. As a good Canadian, anything involving shoveling snow makes a lot of sense to me, right? So when you have a blizzard and there's just snow coming down, right?
Mm,
You have to get the snowplows out while the snow is still falling.
exactly.
You have to be clearing it away all the time, because if you let it build up, the snowplows can't run and you get overwhelmed. It takes longer to dig yourself out.
Yeah.
This is the situation we're in, where the system hasn't been funded long enough at a high enough level, and we're being overwhelmed.
But
right?
is it just funding?
It's partly funding, but if one government says we're going to do this, and 5 years later another says, no, we're going to change that.
Yeah.
And then another says, we can put funding in, but if we never get the work done, we get overwhelmed. And so I think you raise a good point about the NHS always changing direction every 5 to 10 years when a truly new government comes in.
Yeah.
And they decide to restructure things. So I think that is a problem.
I think they get to do that because when you think about it, they come along and say, we've got the answer to the NHS. Labour may have created it, but we're the ones to fix it, the Tories.
Sure.
And they will oppose whatever plans Labour come up with just to oppose it, because they want to say, look, we're different, we're radical, we know the answer. So they come in, okay, Lord Darcy's report's there, and say 3 years, 4 years' time, let's say the Tories come up with something else. They'll get their own Lord or Baroness to do another report. But then still nothing has been done. And then 4 years down, when that report's done, they may go on, I don't know what they call it, a listening exercise up and down the country, delaying tactics.
Consultation.
Yes, consultation, just like the inquiries going on and on. They get the report. You don't know if they're going to implement that report or not. This is the thing. We don't know, because we know through history of reports, either the government implements it or not. Here you go, this report, do it or not, which says to me that's not a commitment. Because if it's a commitment, you would say, this is the national strategy. This is what we're doing. Then you'll have the national strategy and you'll have the localized strategy. Because what one postcode will have issues with may not be in the same postcode, let's say the other end of the country. One plan doesn't fit all regions.
No.
Overall, the government will have a national plan to say what we're going to do, but locally, they will have to have their own plan. Like we said before, there's no need to build a hospital where I live. There's 5. They have to look where it's needed. Sometimes that could be the problem.
Yes.
Is it always going where it's needed or where it's easier?
Yes.
Do you see what I mean?
Yes. Point 13 of Lord Darcy's report is arguing that there's too much money going into large hospital centres. And we need to move some of that service into the community.
Yeah.
It depends on where or which community that money flows into. So if you set up community services, that's great if it's in the communities that need it.
Yes.
He makes a good point here. There's a huge growth in the amount of people in hospitals, but they're not necessarily flowing through hospitals because there hasn't been, we've said this, you in particular have said this time and again, social care support for when people leave hospital hasn't been funded. So what that means is there's large numbers of people who are not flowing through hospitals. And what that means is it creates extra work.
Yeah.
So the people working in hospitals are not as productive, but it doesn't reduce their workload. So they're demoralized.
Yeah.
People are stuck in hospitals, gobbling up funds, not getting good care.
I don't like these mega hospitals. The town I'm from, Stafford, built a mega one in Stoke-on-Trent. It's huge, really big. And the one in Stafford, A&E closes at 8 p.m. So God forbid, if you have an emergency at 8:05,
So where do you go after 8 o'clock?
When me and Andre were at my dad's, Andre got sick with his sickle cell. A&E were just about closing. They said, we can't see you. You're going to have to go to Stoke. So, yes, that's 16 miles. Supposing he was having another stroke. The localised things, they're just going because they seem to think bigger is better. Bigger isn't always better. Remember me telling you, we used to have these community hospitals.
Yeah. And we talked to SureStar.
But we still have one in the borough I live in.
Excellent.
We use that. It was a young lady. Never forget this. We go for routine assessments. Andre went for his heart. They detected the clot on his heart. And there was an ambulance outside. It went to St. Mary's. That's local. That's community.
I think community services are important because it means people who need care don't have to travel as far. For the bulk of people's care, they don't need to be in a mega hospital. The stuff they do to not get sick can be done locally. It's better when people don't have to travel as far. I remember with GPs, a question people used to ask is, do you do home visits? People would be sick, in bed, or not moving. If you need a physician, the physician would come to you.
Do you get home visits in Canada?
I never had a home visit.
Did they do that there?
Some GPs did home visits. Some didn't. Gradually, nobody does home visits. I don't know why it was too expensive to do home visits or the compensation structure, the way physicians get compensated for the work they do.
Yeah.
If you structure it in one way, people will do home visits. If you structure it in another way,
they won't do home visits.
They won't do home visits. They won't do community work.
But haven't you noticed the way that things come around? Years ago, we had infirmaries and then there were community hospitals.
Yeah.
Everything was community. You had district nurses, community. Then some bright spark thought it was a brilliant idea to build monster hospitals.
Yeah.
That took away money from the local community.
Yeah.
When you look at a hospital as big as Stoke, you're going to look at areas like Newcastle, Stafford, Cannock, all these surrounding areas in Staffordshire that had hospitals that are either not there or they're closing early.
Yes.
They've completely shut down children's services. Everything gets directed to Stoke because that's where the money is, but it's not local for everyone.
Yeah.
Do you see what I mean? Whoever did that, they've taken away the importance of social care in the local community.
Yeah.
Do you know what I've always had this dream. Me and my friend Paul used to always talk about this dream, but I used to always have this dream that in the community, you'd have, whether it was a hub, you'd have a mental health specialist.
Yes.
You'll have somebody from housing if you needed emergency housing or your partner abused you and you needed somewhere to go to find an emergency place to sleep. You'd have a GP, a nurse. You'd have all these things we have, but are in separate departments, in separate buildings that close at 5. Our lives have changed. This is no longer the 70s. It's no longer the 80s, and it's no longer the 90s. We are a 24-hour service.
Right.
And we're still not reflecting that.
No.
Reflecting that.
This isn't a 24-hour service. I am excited to talk about the community MDT that I'm a part of for people with sickle cell. It's separate from what the government announced, but consistent with the direction of travel. We've set up, I didn't set this up, but I'm a part of it, is a community multidisciplinary team that looks after people in the community, people with sickle cell in the community, because the bulk of the assistance that people need to stay well, they don't actually need to go to hospital. And this team, there's access to physicians, to consultants as needed, but it's primarily psychology, pharmacy, social work,
Yeah.
nursing,
Yes.
and social prescribers.
Yes.
These are link workers. If someone needs to join a gym, fill out a form, or know where to go to fix a problem, these are the people who help. We're setting this up as a community program. I'm very excited about it. It's a good example of a program that if it's set up now under one government, it would be an awful shame if it was cut the next time the next government comes in because they don't agree with it. This is getting services into the community to
Now
keep
you
people
see,
out
now
of
you
hospital.
see what's
Exactly.
come out of government hands.
Yep.
It really does. This is one of the things I feel strongly about. Some people may feel I'm chatting shit. I don't know. I don't really care. But unless you are a recipient of the NHS, living with a chronic disease or
Yeah.
whatever,
I was thinking about
and
this
you
also.
are reliant on it,
Yeah.
you realize every time a government changes, it impacts it on you. One minute I'm going to Sure Start. Next minute I'm knocking on the door, it's shut. Just like USAID.
If you have a system where there's a lot more support in the community,
Yes.
in different communities that are spread out, that actually gives people, particularly if you have a long-term condition, more freedom to live where you want, right? If you have a long-term condition and the only place you can get any support is in one of these large hospitals, it means you're more like a lot of my patients are pretty much tethered to a large hospital. That limits
there
where
isn't much choice.
there is no choice. It limits where they're allowed to live. They're stuck.
When you're in social housing, you haven't got a choice. You go wherever you are put. You don't have much of a choice. You have a choice when you're looking to buy. And even then, you're limited because of the amount of money that you've got. So there's not really a choice.
Let me give you an example. Many of my patients would love to pursue certain employment opportunities, but it would require them to move out of London. If they could get this job and pay private rent, right? But they can't afford to be far from a specialist center because that's the only service offered. So now they're stuck in London.
London isn't London isn't the only.
No, it's not. But the opportunity they would have, they turn it down. So now they're kind of stuck.
Birmingham, Manchester.
There are regional around, but it's like how far away are you? And I think if a lot of the services people needed were spread out, it would give people more choice, more flexibility.
That's hard because when you're looking at specialism like sickle cell, it's not widely available because the numbers are low. You've got to be realistic, but they're going to be in areas where it's concentrated. But Birmingham has one, Manchester does, other parts of London does. London is not the centre of the universe.
Yeah.
So if you're going to move to Birmingham, you will have to travel within Birmingham to get to see that specialist. You'll have your GP, but you want to see a specialist.
Yeah.
So it depends how much you want that job. Right now, I bet you don't live on the doorstep of the hospital that you are going to now. So what difference would that make if you moved to Birmingham? Have you been? Have you seen where the job is, the hot places to live? Do you see what I mean?
Yeah.
It's about figuring it out. It's not going to be next door. I just happen to live where it's really convenient.
Yeah.
And that's it. But I have lived in places where it hasn't.
Yeah.
Let's get back to Lord Darzi. Lord Darzi said he doesn't just point fingers. He diagnosed a system that's overwhelmed. The difference this time is urgent. It's like the NHS is on its own life support machine and it's nearly flatlining.
Yeah.
We don't want it to flatline.
No.
We're giving it, what's that thing that they do?
The defibrillator?
We're using a defibrillator now. And want to get it back. We want to shock
into a rhythm.
Exactly. But in order to do that, we've got to find out why it got to be nearly flatlined in the first place. which he diagnosed. But many reports have diagnosed. So why now is it more urgent than in 1980? It's always been urgent. I try not to be too cynical, but I can't help it. History tells me that I do have faith in Labour. I try my best to when it comes to the NHS.
Yeah.
But like I said, the downside is when we have elections and governments change. That's the downside. What are the Tories' plans for the NHS? What are reforms' plan? Seems to be the political football that everybody wants to kick and score. Everybody wants to be the one that, I solved the crisis within the NHS. But when you're playing that game, people die every winter. People on a trolley having a heart attack, no beds. Ambulances back to back because there's nowhere to offload the patients. So those are the quote unquote, the crisis in the NHS. The people are the so-called crisis and they can't see it getting better. 7 million on a waiting list. Avalanche, snowing, tumbling.
That's a lot.
Overwhelming.
The snowplows don't clear the snow away quickly.
No snowplows, they can't get through.
Yeah.
Can't see.
It takes a lot of extra work to dig yourself out.
So if you can imagine the snowplows are the money, just follow me with this. The snowplows are the money. Even though we're getting loads of snowplows, nothing much is changing because it's going to take more than money to make this change, to stop the flat line.
What takes more than money?
I don't work there. Reform. It's got to change. Definitely got to change. Before we look at, because when we talk about the NHS, people think of hospital and that's it. I'm thinking of social care.
Yeah.
You cannot clear the crisis in the NHS without first shoveling the avalanche in social care. But because you have made a ruling to state that you are not allowing foreigners to come in to be, working social care anymore, we're going to have a deficit.
Yes.
So you're doing one thing. We need help in social care, but you decide to wake up one day and say, okay, you're not having the social care work visas anymore for foreigners.
Yeah.
Yet it is area that is starving of staff. It's starving. But yet you haven't said what you're going to do to fill that gap.
I'm just thinking about that, looking through the report. Although Lord Darzi recognized a lack of investment in social care was driving the lack of productivity by hospitals, when you look at his 10-point plan, that's section 28 of the report, he lists a whole bunch of things. And what is conspicuously missing is a call for funding that social care.
Are you sure? Really?
Maybe I'm missing it here, but he's saying re-engage staff, re-empower patients, mental health and community services expanding, simplify and innovate care in the neighborhood.
But mental health can be done in the community. Mental health shouldn't be taking up beds in the NHS.
When he talks about beds, he's fixing flow with operational management, investment in buildings, equipment, technology, contributing to the nation's prosperity, top-down stuff, and a balance of management structures. I don't see where he says we're not going to fix the NHS without funding social care properly. That's a glaring omission.
I don't know how they're going to do it.
He diagnosed a significant problem. He recognizes it is a problem.
Social care.
Earlier in the report, that was one of the problems he mentioned, but nowhere is that in his list of 10 solutions.
You're joking. The problem isn't solved. What happens to that problem? It gets worse.
It gets bigger, and
worse,
I suppose that's why we shouldn't be surprised that the government, although they did implement one of the recommendations where they abolished NHS England, this management structure, I think they're trying to do a good job in terms of helping people get an appointment with their GP.
But you need GPs.
But you need GPs. And nowhere in the report, we're going to massively expand social care.
I'm sure I read somewhere that GP desert the most deprived communities.
Mm-hmm.
Exactly where they need to be.
Mm-hmm.
The inequalities. No wonder you never mentioned it. Who wants the data to see in black and white to say it's getting worse? I know there's always going to be health inequalities, but the amount.
Mm-hmm.
If the government are still going to be singing that tune, we're putting the money in, they keep saying it over and over to make people think, oh, we're putting loads of money in, which equates to we're doing something.
Mm-hmm.
It's people aren't feeling the change. People need to feel it. They want to feel the change. I want to know that, like I said before, I'm not sitting in A&E for 10 hours. I'm not going to be lying on a trolley. We don't need to advertise for a corridor nurse. When you put up an advertisement for a corridor nurse, that tells you everything about the NHS.
Mm-hmm.
You don't advertise for where you are now. You advertise for where you want to be. If you do that today, you're going to advertise for another healthcare assistant.
Mm-hmm.
It's going to get, that corridor is going to become its own department.
Yeah.
And then it's going to become normal. And it shouldn't become normal.
No. I've long thought we need a redundant amount of physical space, of rooms to meet people in. So in the work that I do, and I won't mention the trust that I work for, but we don't have enough clinic space. We don't have enough room to see as many patients as we'd like. We have to share, we have to schedule, we have to almost compete for room space. And I'm relatively lucky in that I get some room space assigned to me. But for a long time, I had colleagues who had no room space assigned, even though they were supposed to have confidential conversations with patients. I've wanted to have a group space for a long time. That space doesn't exist. And I think there's some idea within healthcare that if you just make too many rooms, it'll get filled. And so one way of keeping the cost down, I think it gets filled with the staff that look after people. If we had the rooms to see people, it would make it a lot more efficient. I'm a big fan of building spaces. And obviously we've talked about the need to maintain those, fund the maintenance of those spaces. But actually having physical space to see people would be really helpful, even if the staffing level stayed the same. Having space for the existing staff to see people unfettered, that would be amazing.
Do you want to say anything else, other points?
I think the 10-year health plan makes good recommendations, right? Some of it's, I don't know, vague, right? Just let's re-engage staff, whatever that means, or re-empower patients, moving services into the community outside of hospitals, especially for long-term conditions or mental health. He's consistent with that, wanting to simplify things and bring it into the neighborhood. I think that's great. I think one thing that I thought was also interesting was the demand for results. So not just, I think in some ways, the way the healthcare system in this country works is we have these bodies that decide what a good service is. We evaluate a service and say, these guidelines say you're supposed to have X, Y, and Z. And you need to put those people in place. So you need to pay for that. You need to hire these people. And so we've done that. Now we're a good service. Not necessarily. If it's not helping, then you've spent all that money, but you haven't actually provided necessarily a good service. So I think some way focusing on output, not just input, I think that's actually a pretty good idea. Tilting towards technology, AI is going to be a huge thing. We'll probably do a whole podcast episode on that.
What did you just
say? AI is going to be a huge thing in the future.
Yes.
I think we'll need to do a podcast episode about that. It's incredibly important in places like radiology and increasingly in other areas. There's an ongoing debate about whether AI will replace psychologists. I think it will.
Just Dr. Jeremy is AI.
No, I'm not an AI.
I'll have to tell my wife about that.
I sound this calm.
Oh, really?
Yeah, so I think the Darzi Report makes a number of good recommendations. Hopefully, the government will implement some of them. The lack of mentioning social care in the recommendations is a glaring omission.
But do
Yeah.
you think, when you just said, I hope the government implements some of them,
hmm
they've asked him to do another report. He'll be back again in 10 years' time. And I don't think it's good for any government to pick and choose which recommendation to implement. They may choose based on cost.
hmm
He's done this report, got his findings. It should have nothing to do with politicians. People might not, or
hmm
read the summary, the key points, and think, wow, this sounds good, yeah. But then how is it going to work? People want to know the meat on the bones. Right now, we've got the bones, but to get the meat on the bones, we need buy-in from clinicians, professionals, politicians need to commit. And they need to commit by saying, we're going to implement all the recommendations. I don't like all the hoo-ha when Starmer said he wasn't going to have a national inquiry into the grooming gangs. And all uproar, Elon Musk saying what he said. He then, of course, commissioned someone else. As we know, what's her name? Dame Casey. She doesn't pull any punches. And then he quickly says, we're going to implement everything. Why? Because that was news. That you do it because it's the right thing to do. You do it because you should have done it.
Yeah.
You don't do it because you were hung, drawn and quartered to do it, that you were nailed to the cross to do it. He shouldn't have taken another U-turn. Do you see what I mean? Unless the whole country is in uproar over one thing, nothing gets done. He gets obsessed by drama.
Yeah.
As good as that drama may be, it was a drama. We have real knife crime in this country. That's what he should be getting obsessed about, not getting obsessed about a drama. We already have real crime. I could understand if it was a documentary.
Yeah.
It wasn't. It was a drama. It was a drama. So when it comes to another health report, it could be just another health report.
Yeah.
It just doesn't get done, or some gets done and halfway through people get pissed off. That's why it needs a panel. Just like got MI5 and MI6. They're always there.
Yeah.
They're constant. One does Homeland Security, one does the other. We should have a panel that just does this.
An expert panel got about facts. It seems like what you're saying is all these politicians at Westminster, they're playing this kind of game where they're competing with each other, always going back and forth. It's a battle of wits about current drama. Not really what we need. We don't look to politicians to legislate. Certain things are just facts about the world we all have to accept, right?
Yeah.
And we leave some of this other stuff to politicians.
Yeah.
Right? But really, I think what you're advocating for a world in which when there's things that are just facts that nobody is arguing about, that's something we need to take out of politicians' hands. We don't need to, let them fight over it. It wouldn't make sense for politicians to legislate what direction does the sun rise.
They could have, they would.
They would, right? Some of these things might be like that, but we're treating them as a matter of political ideology when they may just be facts. Yeah.
Key similarities between Darzi, Black Report, Akerson, Mummett. Black Report showed class and income affect health outcomes. Akerson Report highlighted the need to improve early years education and social conditions. The Mummett Review focused on social determinants of health, housing, income, education work. Darzi 2024 warns of rising chronic illness linked to poor social conditions and prevention failure. So all reports agree health cannot be improved by NHS reform alone. Upstream social factors matter. Big difference between 1980 to 2024. Technology is changing. AI is here. The way that we look at health is different. The way that we look at social care is a lot different. So moving things from what we might have done in hospital, in acute care, can be done in the community now.
Exactly.
I remember years and years ago when I was little, when women went in to give birth, they were there for days. Now, since the cord, you're on the bus home. You're going home. There's no need to stay. Things change. But the NHS needs to catch up and change with it.
Yeah.
That's what they need to do. They're cycling and pedaling. They're not getting up that bloody hill faster.
No.
It just needs to change.
No.
So perhaps it needs to completely change the way it's always worked, the way they think it should work, the way it should be delivered in terms of who oversees it, who has own control. Do you see what I mean? Secretary of State for Health, government control. Shouldn't that change if the way we view health has changed? No matter what, health inequalities, until we are consistent with all recommendations from these reports and concentrate services and funding in areas that are more at need, not in areas where you're going to get the votes. That's why it needs to change. More now than ever, because we're at a crucial point where the NHS is flatlining. We don't want what America's got. So when somebody says we should try an insurance-based system and people don't fully understand, look at the American system. Look at the amount of poor people that have cancer, can't afford treatment, or diabetes. It may be okay for some, for the majority, it won't be. For us to have a sustainable NHS for the next generation that deserve to have what we are enjoying now, it needs to fundamentally change in a radical way, beyond just looking at management. We need to look at the top.
Yes.
And cut them out. Do you see what I mean?
Yes.
They've got to think beyond ego over keeping this treasured possession that we do have, because we are very lucky that we do have it. Yes, okay, it doesn't work at times. Great. But look at the times it does work. Look at the wonderful stories. You work in it. I use it all the time. I'm not going to say it ain't broken. It may be broken, but it ain't done. And it shouldn't be done.
Yeah.
Because it's a system that has been here for so long, and the next generation have every right to benefit from what we're benefiting from today. We are the caretakers of this system. We have to take care of it for them to benefit from what we have today. We have to make society healthier. It has to be healthier. It has to be fitter. I'm holding out hope, and I don't hold out hope, if that makes sense. I'm praying for the best. Praying for the NHS.
I'm taking your point about taking control of a healthcare system out of the hands of politicians. I need to think about that, but I thought I would throw that.
Are you impressed with what they've done?
No, it's a problem. What's the alternative?
What's the alternative?
I've asked Microsoft Copilot what the alternatives are, and it's come up with 3 potential solutions. One is an independent health authority, a nonpartisan commission that's arm's length from government. The second is technocratic management, putting decisions in the hands of health economists, clinicians, epidemiologists, and systems engineer rather than elected officials. And the other one is social health insurance models. I think that's more like Germany and the Netherlands, where there's non-governmental, non-profit insurance funds that collect premiums and manage coverage. That's like a blended model between health insurance and like the private health insurance that you see in the US versus like a national government healthcare. Oh, and there's a fourth option, cooperative or regional governance. So it's saying letting regions, cities, or even cooperatives, like groups of people, patients, and professionals run healthcare locally. Switzerland uses this model extensively. So
how does that work? It's great to find out.
Yeah, we should explore
how that
this.
actually works.
It would be good if we could find an expert who knew about this stuff and could propose alternative models.
Yeah.
That would be useful to explore.
I like the idea that if we do have to have government officials on it, that it is cross-party.
Yeah,
from each party.
Yeah.
You don't want it to be just because Labour are in power or the Tories are in power that they dominantly are the only ones. No, I think that if there's a panel, someone from each of those parties should be on that. It doesn't mean they make the major decisions, but I think it would be good to look at other systems.
I've been reluctant to jump on the bandwagon with you, Val, in terms of saying we got to take it out of their hands, because I don't know what the alternatives are, right?
No, we don't. Look, we don't have to have all the answers. Government don't. What I'm saying is we've tried this for so long, and reports going back as 1980 till
We're going
now.
back 45 years. Yeah.
It's gotten worse. It's more than just money. It's further up the ladder. And perhaps if you don't try something different and radical, you'll never know. Unless we have that conversation, we won't explore other options. We just think, it's supposed to be this way.
Are you going to get radical?
No, it's not just that.
Are you going to vote Reform UK?
No, I bloody wait. They're quick to get rid of the Quangos and blame them. It's there. 1 minute you got your Quango in, your Quango out, in, out. Come on, shake it all about. 1 minute you've got community hospitals, in, out. They go round and don't know what they're doing. They rehash things that they said we didn't need decades ago. They bring it back and realise that it was a mistake.
Yeah.
And these people are supposed to have gone to the best schools, the best universities, and they still haven't got a blood hand in what's going on. They still haven't made a major impact on the NHS. These reports are just a report until they action it. Just something written on paper, and I bet there'll be another one.
Yes.
Whether it's today or tomorrow, there will be another one, and I can bet you bottom dollar. The only thing that would have changed is that health inequalities has gotten wider. And on that note, I can predict it. I think they should get us to do the report and cut and paste from the best of these reports.
Yes.
It's just, if I don't laugh, I'll scream.
Yes.
It's a disappointment.
We'll stick a pin in it there. And it's time for me to go look at making dinner.
What are you making?
We're going to make some chicken tonight, but I think I'm probably going to try to cook outside on the barbecue rather than inside. It's just going to heat up the house.
Do you cook for your dog or give him tin food?
Oh, we give him kibble.
Some people cook for their dogs.
Sometimes we'll give him some chicken. He does love chicken. It's true.
Really? Oh, okay.
Most of the time, we just give him kibble.
Is that dry?
It's dry stuff. All salmon. We found his digestion works best when he gets pure salmon.
Okay.
It's salmon kibble, but it's fish. Yeah.
And next week, we were going to do our common sense solutions.
We'll figure something out.
solution.
Yeah.
Thank you for listening. Follow us on our socials. Tell people about us. Let us know your thoughts. Do you agree with me, with Val Barrett, that NHS should be taken out of politicians' hands? Good to know.
Comment or review.
See you later.
Bye, Val.